Okay, so next up we have, one moment. We have Ray Barishansky, who is, sorry, I have to do quite some, who's the Chief of Public Health Emergency Preparedness at Prince George's County in Maryland. The Prince George's County Health Department presenting what goes on behind closed pods.
Good morning, everyone. So we all work in public health emergency preparedness. We are used to challenges. These challenges can be big, they can be small, they can be in your health department, they can be outside. One of my biggest challenges when I got my job, which is in Prince George's County, Maryland, the National Capital Region, otherwise known as Anthrax Alley, was trying to figure out how to mass dispense to a population of about 1 million. Let me make it clear. Right away I knew one of my challenges was I didn't have the capacity. I needed to reach out, and I needed to reach out to some of my partners. These were closed pod partners. I need this slide up there to make it very clear to you that I couldn't do anything without significant buy-in from my health department leadership. So I approached them with my idea, with my vision. Thank goodness they embraced it. So one of the first moves we made after that is we figured out right away that the brass ring of public health emergency preparedness is mass dispensing. So although I use partners for a lot of things, one of the things I needed to make very clear was that that pod, that setup, is going to be what I need them to do. I had to investigate. I had to look around my county and say, what's out there? And you all probably need to do the same thing. Look in your county, state, wherever you are, region, and say, what's out there? What can I possibly use to help me do my job? In this case, to mass dispense. That's actually a picture of Andrews Air Force Base. Don't look too long. There's a guy in a black van who will take down your name and social security number. And that was one of our first closed pod partners. They're big, and they're in Prince George's County, and they wanted to partner with us. We also looked at things that I had never heard of before called a mega church. I don't know if anyone's heard of that. I'm from New Jersey. We don't have those. But they do have them in Prince George's County, and we did need to embrace those partnerships to dispense. So closed pod partners, military bases, we have faith-based organizations, and we have some universities and colleges. Reaching out to them was exceptional. This is the University of Maryland in College Park. They serve a population of about 34,000. That's pretty big. It would take a chunk of things off of my plate, and isn't that the goal? Also, some municipalities. There were at least 3 or 4 distinct municipalities that approached us and said, we want to be involved, which actually made it a little easier because we didn't have to approach them. So for our closed pods, we allowed municipalities also to dispense. And we also had federal entities. When we went to certain entities, like NASA Goddard and the IRS, they understood what we were trying to accomplish. Federal entities can be your best friends, but work slowly with them, okay? They want to be explained. One of the first steps we did with all of them, we had meetings, okay? And all we did was explain to them the closed pod process, what was going to be entailed, what they were going to have to do. But let me make it very clear, like I said before, they each have certain capabilities. They each have certain things that they can do well, and they each needed to have buy-in. When we went to NASA Goddard, they have a medical director there and a full medical team. That made things easy. Clearly, some municipalities and other places wouldn't have that, and therefore they wouldn't have the same buy-in. But we couldn't go anywhere without first having an MOU. And that's one of the big hurdles, because that really separates things. If you're very serious and very interested in being a close pod partner and helping us with mass dispensing, then we'll get the MOU from you. Once we got an MOU, one of the things that we tried to do was make sure that every single one of these entities had some sort of emergency plan with a mass dispensing element. And that meant more work for us on some level. Let me make it clear, because we had to look at those and make sure they were realistic. We had to look at those and make sure they fit with what we do. After we looked at their plans, we always train with our closed pod partners. So whether it's tabletops, or even allowing them to sit in on other exercises, or functional or full-scale exercises, we try to make sure they know they're part of our team, okay? 11%. We went from 0% to 11% of our population covered by our closed pod partners in about 1.5 to 2 years. Don't get me wrong, we're not satisfied with 11%, but for a 2-year investment, I would say I'm pretty happy about it. It's about relationships. You're going to be hearing that from people today. You've heard about it already and hear about it later. But I will tell you that our closed pod partners are not just about closed pods. They helped us with flu vaccination campaigns, and they helped us with other public health preparedness initiatives. And it's great. So what does the future hold for us in regard to Prince George's County? Well, I'll tell you, we want to keep up with the exercises and training and drills, and we want to keep up with the people we have already. But one of the other things we really need to focus on is the joke I made about 2.5 minutes ago about the mega churches. They are huge, and we haven't even begun to tap into that exceptional resource that they are. They've been great. The churches that we've already brought on board have been exceptional, but we need to expand that effort, and that will probably put us at about 20% of our population covered. Okay? So when we talk about what happens behind closed pods, I've tried to give you a brief overview of everything we've done, but I'd like to end by saying the effort's never really over. This is constant and ongoing. One of the things that we're trying to do is make sure that we take care of people during a massive public health emergency. We're going to need assistance with that. It keeps going. Thank you all very much. Have a great day.